Now this is the scapula. This is the right side of scapula. Anatomical points. The costal surface is concave, directed upwards and forwards. The dorsal surface is convex, directed backwards. The superior border directed upwards, and the coracoid process is directed laterally and forwards. Now morphological parts of scapula. First of all, there are two surfaces, costal surface and dorsal surface. Three borders, superior border, lateral border and medial border. Three processes, spinous process, acromion process and coracoid process. And three angles, superior angle, glenoidal angle or lateral angle and inferior angle. Now first surfaces, the costal surface. Costal surface consists of subscapular fossa, which contains the subscapularis muscle, and there are various ridges present in the costal surface which goes from the medial border towards the lateral border and gives attachment to the intramuscular septa, and this intramuscular septa accommodates more muscle fibers and thereby increases surface area, and thus the subscapulary muscle acts as a multiminute muscle. This is all about the costal surface. Now the dorsal surface. Dorsal surface has superior part and inferior part. Superior part consists of supraspinous fossa and infraspinous fossa. Supraspinous fossa, along with the superior surface of the spine, gives attachment to the supraspinatus muscle, and infraspinous fossa, along with the inferior surface of the spine, gives attachment to the infraspinatus muscle. And in the whole of the infraspinous fossa, except the strip in the lower part, which gives the origin of the teres major muscle, contains the infraspinous fascia. And this is the importance of infraspinous fascia is during scapular injury. There is hematoma or collection of blood in the scapula, and this is confined only to this infraspinous fascia and does not goes to other parts of the body. Now attachments of the borders. First is the medial border. Medial border, in the upper elevated portion 1/3, there is attachment of the first digitation of serratus anterior. In the medial strip there is second and third digitation, and in the lower part there is lower 5 digitations of serratus anterior muscle. Now as we go in the dorsal aspect, in the upper part there is levator scapula. In the triangular portion formed by the spinal face of the scapula there is rhomboideus minor, and the lower whole part there is rhomboideus major. Now lateral border. Lateral border in the costal part, this lateral border acts as a lever and gives attachment, provides the movements of the serratus anterior muscle. Now in the dorsal aspect, below the glenoid cavity there is infraglenoid tubercle, which gives attachment to the long head of triceps. Then in the upper 2/3 gives attachment of teres minor, and the lower 1/3 gives attachment of teres major muscle. Now the superior border. Superior border consists of a notch known as the suprascapular notch. Suprascapular notch can be converted into a suprascapular foramen by suprascapular ligament like this, and through this foramen suprascapular nerve pass, and above this suprascapular vessels pass. Now they pass and goes like this and goes inside of this notch. This notch is known as spinoglenoid, spinous face and glenoid cavity. So this is a spinoglenoid notch, passes through this notch, and this notch can also be converted into a foramen by the spinoglenoid ligament. Now the angles. Angles are superior angle. First, superior angle has two main relations, that is the trapezius muscle and the spinal part of the accessory nerve. Now glenoidal cavity. Glenoidal cavity or lateral angle. The outer part, it gives attachment to the glenoidal labrum, and in the above part there is a tubercle known as the supraglenoid tubercle, and gives attachment to the long head of biceps brachii. And then in the constricted portion surrounding the glenoid cavity, it is known as the anatomical neck, and another neck is known as the surgical neck. So the surgical neck is an imaginary line which goes from the suprascapular notch on the costal aspect, goes like this, and then pass through the infraglenoid tubercle, goes between the spinoglenoid notch and terminates in the suprascapular notch and forms the surgical neck. This is known as surgical neck because most fracture occurs in this area. Then inferior angle gives attachment to the latissimus dorsi muscle. Now there are three processes: spinous process, acromion process and coracoid process. The first is spinous process. It has an apex, a base, this is the base, then it has an anterior border, it has superior surface, and it has inferior surface and a free posterior border. Now free posterior border has an upper lip and lower lip. Upper lip extends as the upper part of the acromion process, and lower lip extends the lower part of the acromion process, and upper lip gives attachment to the middle fibers of trapezius, and lower lip gives attachment of the posterior fibers of deltoid. Now acromion process. Acromion process has a tip, an acromion angle, medial border, lateral border, dorsal surface and under surface, and it has a facet which is forms the joint, the acromyoclavicular joint. Then we have the coracoid process. Coracoid process has a superior surface, inferior surface, anteromedial border and posterolateral border. In the anteromedial border, it has an anterior part and a posterior part. Anterior part gives attachment of the pectoralis minor muscle, and posterior part gives ligament known as the coracoclavicular ligament, and in the posterolateral border it has an anterior part and a posterior part. Anterior part gives the ligament which is the articles of the humerus, which is the coracohumeral ligament, and this is the coracoacromial ligament. Now this coracoacromial ligament, first the Coracoid process, then the coracoacromial ligament, and the whole acromial process together they forms an arch known as the coracoacromial arch, which supports the glenoid cavity.